Good morning, everyone, and welcome to the Human Services Joint Subcommittee Budget Closing Hearing. Could the committee secretary please call the roll?
Senator Cannizzaro, Senator Dondero Loop,
Here.
Senator Hammond,
Here.
Senator Kiefer,
Here.
Senator Ratty,
Here.
Assemblywoman Benitez Thompson,
Here.
Assemblywoman Carlton,
Here.
Assemblyman Frierson,
Here.
Assemblyman Roberts,
Here.
Assemblywoman Titus,
Here.
Assemblywoman Tolles,
Here.
Assemblyman Watts,
Here.
Chair Monroe Moreno.
And I am here. I know that Senator Cannizzaro is running just a few minutes late, and when she joins us, please mark her here and please remind me if I fail to let you know, Committee Secretary, that when she arrives. Members, we have budget closings on DHHS and the Welfare and Supportive Services today. So we're going to take about a 10-minute recess to allow the members to print their documents for today and for it to be uploaded to Nellis. So we should be back here at about 8:18. If you get it together earlier than that, let me know. Thank you. Thank you.
Chair, we are unmuted and live to the broadcast.
Thank you. And we will reconvene the subcommittee budget closing hearings for Human Services. And Committee Secretary, just wanted to let you know that Senator Canizero has joined us. And with that, staff, we will go to our first budget, 3150.
Thank you, Madam Chair. For the record, this is Karen Hoppy, LCB Fiscal Analysis Division. On today's agenda for the Department of Health and Human Services Director's Office, there are 8 budgets that are agendized. The first 5 were heard in the subcommittee hearing, and 3 are staff closed budgets, which we will discuss at the end. To begin, let's start on page 3 of your closing package. This is for the Department of Director's Office Administration Budget, account 101-3150. There is one major issue, which starts at the top of page 4 of your closing packet. And this is the governor's recommendation to transfer the Office of Minority Health and Equity from the Office of Consumer Health Assistance budget to the administration budget. According to the agency, the office works statewide and provides support for all divisions within the DHHS. And the proposal to move the Office of Minority Health and Equity into the administration budget would allow department-wide coordination. According to the agency, the Office of Minority Health and Equity has been functioning as a program at the department level and across divisions, addressing challenges in minority health, such as lack of awareness and engagement, discrimination, diversity, equity, inclusion, identifying resources, and data. During the February 4th, 2021 hearing, the subcommittee was interested in the anticipated benefits of moving the Office of Minority Health and Equity from the Office of Consumer Health Assistance budget to the administration budget. The agency indicated that with the governor's recommendation to move the Office of Consumer Health Assistant budget, currently located in the Director's Office, to the Aging and Disabilities Services Division, it recommended retaining the Office of Minority Health and Equity within the Director's Office, thus preserving the department level coordination and focus for the office. Does the subcommittee wish to recommend retaining the Office of Minority Health and Equity in the Director's Office, but transferring it from the Office of Consumer Health Assistance budget to the administration budget?
Thank you so much. I will take a motion on the transfer.
So moved, Madam Chair. I'll second.
Second. Any discussion on the motion? Seeing none, I will ask for a roll call vote.
Senator Canizero,
Yes.
Senator Dondero Loop,
Yes.
Senator Hammond,
Yes.
Senator Kiefer,
Yes.
Senator Ratty,
Yes.
Assemblywoman Benitez Thompson,
Yes.
Assemblywoman Carlton,
Yes.
Assemblyman Frierson,
Yes.
Assemblyman Roberts,
Yes.
Assemblywoman Titus,
Yes.
Assemblywoman Tolles,
Yes.
Assemblyman Watts,
Yes.
Chairman Monroe Moreno.
And I am a yes. The motion carries. Next item.
Thank you, Madam Chair. On page 5, still in the administration budget, there are 3 other closing items. Staff notes a technical adjustment in item 3 in the base budget. Historically, this budget has not included a reserve category, as unspent general fund appropriations are reverted at the end of the year. Fiscal staff confirmed with the agency a reserve category was not appropriate and should be removed. Staff has made that fiscal adjustment or technical adjustment, and with that adjustment, this recommendation appears reasonable. Fiscal staff recommends other closing items 1 and 2 be closed as recommended by the governor, and other closing item 3 be closed with a noted technical adjustment, and request authority for staff to make other technical adjustments as necessary.
Members, any questions? Seeing none, I'll take a motion from Senator Ratty,
So moved.
second from Assemblywoman Carlton. Any discussion? Seeing none, I'll call for the vote.
Senator Canizaro,
Yes.
Senator Dondero Loop,
Yes.
Senator Hammond,
Yes.
Senator Kiefer,
Yes.
Senator Ratty,
Yes.
Assemblywoman Benitez Thompson,
Yeah.
Assemblywoman Carlton,
Yeah.
Assemblyman Frierson,
Yes.
Assemblyman Roberts,
Yes.
Assemblywoman Titus,
Yes.
Assemblywoman Tolles,
Yes.
Assemblyman Watts,
Yes.
Chair Monroe Moreno.
And I am a yes. The motion carries. Next budget closing.
Thank you, Madam Chair. Moving on to page 7 of your closing packet. This is the Family Planning Office, account 101-3155. There is one major closing issue, which is a budget reduction. The governor recommends general fund reductions of $621,707 in each year of the 2021-23 biennium, with corresponding reductions to the family planning category. The recommended reduction would result in family planning category authority of $2.4 million in each year of the 2021-23 biennium, which represents a 20.7% reduction from the $3 million per year approved by the 2019 legislature. The agency indicates this recommendation would more closely align program revenues with actual expenditures incurred in fiscal 2020 of $2.3 million. A total of $680,190 was reverted to the general fund in fiscal year 2020. The agency indicated the main challenge it experienced in expending the category authority in fiscal year 2020 was the impact of COVID-19. For fiscal year 2021, the legislature did not enact reductions to this budget during the 31st special session, so expenditure authority remains at $3 million as approved by the 2019 legislature. During the February 4th budget hearing, the subcommittee was interested in a breakdown of the family planning grant award actual expenditures and a breakdown of the grant award expenditures of $3 million in fiscal year 2021. For the committee's reference, this is attached as attachment A following this budget document. Additionally, the subcommittee inquired whether the agency expected to expend the total $3 million fiscal year 2021 authority approved by the 2019 legislature. The agency indicated its intention to expend that funding. And if a provider were not able to deliver the services, the agency would seek other organizations to provide the services. Does the subcommittee wish to recommend general fund reductions of $621,707 in each year of the 21-23 biennium, resulting in family planning category authority of $2.4 million per year?
Thank you. Members, discussion, questions. I think Assemblywoman Carlton has a question.
Thank you, Madam Chair, very much. I mean, this was, it's so good to see this budget because for so many years we fought to do something like this and we were able to finally do it last legislative session. And there was a lot of debate about what the right number might possibly be. So we tried to err on the side of putting enough there to make sure it got done, but not overdoing it because we didn't want to have money sit there and not go to good use. So I'm happy to see that we've kind of landed on a number that we think will really work. I don't want folks to look at this really, when we talk about cuts, I think this is more of an adjustment towards what the dollars and the work will really happen when the money hits the streets for this. So I'm very glad that this budget is moving forward, and I think we have found a good amount to make sure that we can get the work done that the state would like to get done. Thank you very much for the comment.
Madam Chair.
Thank you, Assemblywoman Carlton. Assemblywoman Titus.
Thank you, Madam Chair. I too appreciate and want to follow up with what Assemblywoman Carlton just said. And I also want to acknowledge the information that Director Whitley provided and the breakdown of the family planning and where all this money is going. So I think that's really helpful to recognize that it actually is throughout the state. And I think it's real important that we were able to actually look at the numbers and realize how this money is being spent up and down, east and west. So thank you very much. And I just want to acknowledge Director Whitley getting that information to us.
Thank you. Any other comments or questions? Seeing none, I will call for the motion.
So moved.
We have the motion from Senator Ratty, second from Assemblywoman Carlton. Any discussion on the motion? Seeing none, I will call for the vote.
Senator Canizaro,
Yes.
Senator Dondero Loop,
Yes.
Senator Hammond,
Yes.
Senator Kiefer,
Yes.
Senator Ratty,
Yes.
Assemblywoman Benitez Thompson,
Yes.
Assemblywoman Carlton,
Yes.
Assemblyman Frierson,
Yes.
Assemblyman Roberts,
Yes.
Assemblywoman Titus,
Yes.
Assemblywoman Tolles,
Yes.
Assemblyman Watts,
Yes.
Chair Monroe Moreno.
And I am a yes, and that motion carries. Moving on to 3203.
Thank you, Madam Chair. Again, for the record, Karen Hoppy, LCB Fiscal Analysis Division. On page 21 of your closing package begins the next budget, data analytics, account 101-3203. There is one major closing issue, which is a proposal for a new centralized data analytics office and a new budget account. Through a series of decision units transferring existing resources from other DHH divisions and new general fund appropriations of $313,977 over the 21-23 biennium, the governor recommends establishing a new office of data analytics and budget within the director's office, which would include 27 FTE and total funding of $6 million over the 21-23 biennium. According to the agency, the centralization of DHHS data analytics within a single unit in the director's office would support the department-wide strategy of standardization, collaboration, and capacity building in relation to analytics, which could lead to improved service delivery and cost savings. Although resources are distributed, the agency would like to quantify community need that reaches beyond the silos of individual DHHS divisions. There are several tables on page 22 and 23. The first table displays what the revenue and expenditure categories of this new budget would be. The next table at the bottom of page 22 shows the various decision units that transfer and resources from DHHS divisions into this new budget account. And then at the top of page 23 is a table that shows the breakdown of the 27 existing positions that are proposed to be transferred. According to the agency, all 27 positions would physically move from their current division locations to the DHHS Director's Office location. The personnel that are proposed for transfer were identified by each division's leadership as resources that would benefit from the collaborative efforts in a centralized team, and our staff who must problem solve in order to answer more complex data-driven questions. These positions, while no longer physically located with their division programs, would still maintain direct communication with the programs they support and would be expected to meet all existing deliverables. The department offered examples beginning at the bottom of page 23 and into page 24 of data analytics tasks that the team would work on and how those analytics would help manage department resources and aid management decisions. During the February 4th budget hearing, subcommittee observed that no resources were transferred from the Division of Healthcare Financing and Policy to form the new Office of Analytics. In follow-up after the meeting, the agency indicated that position salaries within the Division of Healthcare Financing and Policy are qualified to receive a higher federal match, and not wanting to lose that funding, the agency did not move any positions formally into the new Office of Data and Analytics budget. However, the division has identified 10 positions from that division that would work collaboratively with the new central office. Fiscal staff has included a technical adjustment in this closing document to update the classification of a position transferred from the DCFS administration budget and decision unit E913. A corresponding technical adjustment was included in the DCFS administration budget, which was heard on April 6th. Does the subcommittee wish to recommend approval of the governor's recommendation to establish a new Office of Data Analytics function and corresponding budget within the Director's Office, including the technical adjustment noted by fiscal staff?
Members, any questions or discussion before we go to the motion?
Thank you, Madam Chair. If I could ask a couple of questions and then go from there, would that be okay?
That'll be okay. Assemblywoman Carlton.
Thank you. So trying to go back, one of the hazards of doing these budget closings is we have a conversation in one month and we make a decision in the following month. So sometimes I have to go back and jog my memory just a little bit. So if I'm remembering correctly, these positions will all come in, and now is this a actual physical transfer of folks, or is this an administrative transfer into one unit? There's a difference between the physical and then just the administrative, and I believe, is this both?
Assemblywoman Carlton, it's staff's understanding that these positions would physically transfer to a single location once the COVID restrictions are lifted.
Thank you. And I just wanted to make sure, because I kept in my mind, I kept thinking it was an administrative, we're going to put them all in one group and they're all going to work together, but it will be physical. And I think that's good, because we need folks in the same space that are working with each other to be able to deal with some of the issues that we're doing. So all of these are current positions that are going to be moving over into this office. Correct?
That is correct.
Can always change a statement into a question by just adding that one word. So I think what I've noticed through this whole thing is, and all the work that has been done in the Department of Health and Human Services, especially over this last year. They have really stepped up and done a lot for the state this last year, above and beyond what we normally would ask them to do. That other duties as assigned became a very big thing for them this last time around. And I'm looking at all the times that we've gone to them for different information, all the work that's being done there. I'm looking at a number of the bills and policies that we're looking at. And I'm just concerned that we don't have enough folks at the upper level to help manage all this. We have a great team there, but it's been a long year. And I think we always need to keep in the back of our mind succession planning. We're not going to have all these wonderful folks. A lot of them are getting to that point where, I think I wouldn't blame them if they wanted to retire. So I'm wondering if, for the conversation for the committee is to maybe at a later date, not necessarily today, but, ask staff to reach out to the director's office and just talk about what position they think they might need in order to be successful with all the policy changes. We have Rescue Act money coming. There's a lot of things going on. We want to make sure that we've got the right people in the right place. So that would be my request, that we just have that conversation and see where we think the best place for a person would be to help this office succeed over the next couple of years. Thank you, Madam Chair.
Thank you. Any further discussion, comments, or questions? Okay, well then, can I get a motion for the approval of the governor's recommendation to establish a new Office of Data Analytics functions and the corresponding budget within the director's office, including the technical adjustments noted by fiscal staff?
So moved.
A motion from Assemblywoman Carlton,
Second.
second from Senator Ratty. Any discussion? Seeing none, I will call for the vote.
Senator Canizaro,
Yes.
Senator Dondero Loop,
Yes.
Senator Hammond,
Yes.
Senator Kiefer,
Yes.
Senator Ratty,
Yes.
Assemblywoman Benitez Thompson, Assemblywoman Carlton,
Yes.
Assemblyman Frierson,
Yes.
Assemblyman Roberts,
Yes.
Assemblywoman Titus,
Yes.
Assemblywoman Tolles,
Yes.
Assemblyman Watts,
Yes.
Chair Monroe Moreno.
And I am a yes, that motion carries. Moving on to our next budget closing, 3204.
Thank you, Madam Chair. On page 27 of your closing packet is the Consumer Health Assistance Budget 101-3204. There is one major closing issue beginning on page 28 of your packet. The governor recommends transferring in the Nevada 211 program to this budget from the grants management unit budget, and then transferring the entire Office of Consumer Health Assistance budget to the Aging and Disability Services Division, or ADSD. The consolidation of consumer protection programs within a single division is intended to create efficiencies and improve services to Nevadans through coordination of resources. The Nevada 211 is a Department of Health and Human Services, DHHS program designed to help Nevadans connect with the services they need. Currently, Nevada 211 is administered by the Grants Management Unit budget. Decision Unit E904 recommends transferring the Nevada 211 program including tobacco settlement funds totaling 1.7 million over the 21-23 biennia, one part-time social services program specialist position, and all associated program costs to the Office of Consumer Health Assistance, or OCHA. Additionally, the executive budget recommends transferring the OCHA budget to the DHHS Director's Office, from the DHHS Director's Office to the ADSD. This proposal would bring together existing programs housed at various divisions, such as Nevada 211, Community Advocates, Healthcare Navigators, Long-Term Care Ombudsman, Adult Protective Services, and the Patient Protection Commission under a single division within the ADSD. During the February 4th budget hearing, the agency confirmed there would be no changes to the operation of the Nevada 211 program. The subcommittee expressed concerns about moving the Office of Consumer Health Assistance to the Aging and Disability Services Division, indicating that the functions of the OCHA and the ADSD do not necessarily align. In response, according to the agency, the OCHA provides the direct service, which aligns better with the work of the divisions, and ADSD has the largest advocacy programs. The agency noted each of these ADSD programs have been working together to share information and resources and to improve the coordination of services across these programs. The subcommittee also expressed concern that consumers may have difficulty finding the OCHA if it was transferred to the ADSD. In response, the agency indicated the OCHA would continue using the same phone number, email address, and website. And additionally, that the ADSD has multiple programs represented at outreach events, which would provide opportunity for the OCHA to share information about OCHA's services and how consumers can contact OCHA for assistance. Does the subcommittee wish to recommend approval of the governor's recommendation to transfer in the Nevada 211 program from the grants management unit budget and then transfer the entire Office of Consumer Health Assistance budget to the Aging and Disability Services Division?
Chair, comment.
Senator Ratty?
Thank you. So I know we had some discussion on this at the last time. I've been putting some more thought into this, and I actually think that, while many of these are statewide, because they are all advocacy programs and are sort of outward facing, making sure that we're helping Nevadans navigate, that having them all in one place makes a lot of sense. And just that example of we're going out to health fairs or community events, they can know each other's programs and areas and be able to, divide and conquer, but share everybody's information. So I have come around to thinking that this is a good idea.
Thank you. Any other comments, questions?
If I may, Madam Chair.
Sure, Assemblywoman Carlton.
Thank you very much, Madam Chair. It's Friday and things are a bit disjointed. I had some concerns about 211, but I got some really good answers on that. We know, especially over this last year, 211 has been absolutely invaluable. I cannot tell you how many times I got calls in my daytime job, and the first thing they said was 211 gave us your number. What can you do to help? So I just wanted to make sure that that program stayed solid. It's been around for a while, and I've been given assurances that it will continue. This is merely a paper transfer that facing the client, facing our constituents, they're not going to see a difference. The work will still get done. So with that guarantee, I feel much more comfortable in processing this item. Thank you very much.
Thank you. Any other discussion before I call for the motion?
Madam Chair.
Senator Kekeffer.
Thank you. I still have some reservations about this move. I'm not sure, but I tend to trust Ms. Schmidt. She seems to think it's a really good idea. So I'm going to default to that position. but I wanted to at least say something since I'd expressed concerns about it in the past. Thanks.
Thank you. Any other comments, questions? Seeing none, then I will take a motion.
Move to transfer the Nevada 211 program in the Office of Consumer Health Assistance budget to the Aging and Disability Services Division.
A second.
Second.
Second from Assemblywoman Carlton. The motion was made by Senator Ratty. Any discussion on the motion? Seeing none, we'll call for the vote.
Senator Canizaro,
Yes.
Senator Dondero Loop,
Yes.
Senator Hammond,
Yes.
Senator Kiefer,
Yes.
Senator Ratty, Assemblywoman Benitez Thompson, Assemblywoman Carlton,
Yes.
Assemblyman Frierson,
Yes.
Assemblyman Roberts,
Yes.
Assemblywoman Titus,
Yes.
Assemblywoman Tolles,
Yes.
Assemblyman Watts,
Yes.
Chair Monroe Moreno.
And I am a yes. And that motion carries. Moving on to the other closing items.
Thank you, Madam Chair. At the bottom of page 29 are the other closing items for this budget. Fiscal staff recommends other closing items 1 through 3 be closed as recommended by the governor, and other closing items 4 and 5 in accordance with decisions made by the subcommittee and the corresponding budgets, and request authority for staff to make other technical adjustments as necessary.
Any questions or discussions on the other closing items before I call for the motion? Seeing none, then I get a motion.
Moved.
I have a motion from Senator Ratty, a second.
Second.
A second from Assemblywoman Carlton. Any discussion on the motion? Seeing none, we'll call for the vote.
Senator Canizaro,
Yes.
Senator Dondero Loop,
Yes.
Senator Hammond,
Yes.
Senator Kiefer,
Yes.
Senator Ratty,
Yes.
Assemblywoman Benitez Thompson, Assemblywoman Carlton, Assemblyman Frierson,
Yes.
Assemblyman Roberts,
Yes.
Assemblywoman Titus,
Yes.
Assemblywoman Tolles,
Yes.
Assemblyman Watts,
Yes.
Chair Monroe Moreno.
And I am a yes, and that motion carries. Moving on to budget closing 3195.
Thank you, Madam Chair. Again, for the record, Karen Hoppy, LCB Fiscal Analysis Division. On page 31 of your closing package begins the Grants Management Unit budget, account 1013195. There is one major closing issue beginning at the top of page 32 of your packet, and this is the governor's recommendation for allocation of tobacco settlement funds to the Grants Management Unit budget. The governor recommends a spending plan of tobacco settlement funds for the Grants Management Unit budget of $13.3 million over the 21-23 biennium for allocations to sub-grantees. Detailed discussions regarding tobacco settlement funds allocated to individual DHHS budgets occur when those individual budgets are heard before the subcommittee. The following table outlines the tobacco settlement allocations for the Grants Management Unit budget only. As reflected in the table, the executive budget recommends 13.3 million over the 21-23 biennium. The GMU, Grants Management Unit allocation levels for each program are similar to the spending plan that was approved by the 2019 legislature. During the February 4th budget hearing, the subcommittee inquired about the projected cash flow for the Fund for a Healthy Nevada Tobacco Settlement funding on a department-wide basis. Pursuant to Section 98 of AB3 of the 31st special session, $16.9 million was transferred from the Fund for a Healthy Nevada to the general fund of fiscal year 21, which had the effect of reducing the expected fiscal year 2021 ending balance from 3.7 million to 20.3 million, as shown in the table on page 33. The agency testified that their analysis indicated sufficient cash flow for the 21-23 biennium, but expenditures may have to be reduced in future biennia if the swept Fund for Healthy Nevada funds were not restored. Fiscal staff would note that the estimates from the Treasurer's Office for future tobacco settlement payments, as reflected in the above table, are conservative compared to the 4-year average actual receipts of 24 million per year. Additionally, the agency testified during the budget hearing that 90% of allocations are typically expended every year. Both these factors would contribute to a fund reserve cushion that may result in a higher fund balance at the end of fiscal year 2023 than is projected in the table above. Additionally, during the hearing, the subcommittee was interested in the reliability of future tobacco settlement fund payments and whether the master settlement agreement reached in November 1998 had an end date. In follow-up, the agency indicated after consulting with the Treasurer's Office that the MSA terms provide for annual payment to the states in perpetuity, and the Director's Office is not aware of any concerns with the reliability of future receipts. Does the subcommittee wish to recommend approval of the spending plan of tobacco settlement funds for the grant management unit of 13.3 million over the 21-23 biennium as recommended by the governor?
Thank you. Members, any questions or discussion before I call for the motion? Seeing none. Senator Reddy?
I would make a motion to recommend approval of the spending plan of tobacco settlement funds as indicated in Governor's Rec.
And the second?
Second, Madam Chair.
A second from Assemblywoman Carlton. Any discussion on the motion? Seeing none, I will call for the vote.
Senator Canizaro,
Yes.
Senator Dondero Loop,
Yes.
Senator Hammond,
Yes.
Senator Kiefer,
Yes.
Senator Ratty,
Yes.
Assemblywoman Benitez Thompson, Assemblywoman Carlton, Assemblyman Frierson,
Yes.
Assemblyman Roberts,
Yes.
Assemblywoman Titus, Assemblywoman Tolles,
Yes.
Assemblyman Watts,
Yes.
Chair Monroe Moreno.
And I am a yes. That motion carries. Moving on to the other closing items.
Thank you, Madam Chair. On page 34, there are 4 other closing items for the Grants Management Unit budget. Fiscal staff recommends other closing items 1 through 3 be closed as recommended by the governor, and other closing item 4 in accordance with decisions made by other technical adjustments as necessary.
Thank you. Members, any questions or discussion on the other closing items? Seeing none. Senator Reddy?
I move to approve.
And second,
Second, Madam Chair.
thank you, Assemblywoman Carlton. It's been moved in second. Any discussion on the motion? Seeing none, we'll call for the vote.
Senator Canizaro,
Yes.
Senator Dondero Loop,
Yes.
Senator Hammond,
Yes.
Senator Kiefer,
Yes.
Senator Ratty,
Yes.
Assemblywoman Benitez Thompson, Assemblywoman Carlton,
Yes.
Assemblyman Frierson,
Yes.
Assemblyman Roberts,
Yes.
Assemblywoman Titus,
Yes.
Assemblywoman Tolles,
Yes.
Assemblyman Watts,
Yes.
Chair Monroe Moreno.
And I am a yes. That motion carries. Moving on to our next budget, 3154.
Thank you, Madam Chair. I will now begin presenting the three budgets which the subcommittee has not previously reviewed for the Department of Health and Human Services Director's Office, and for which fiscal staff is responsible for developing closing recommendations. I will pause following my presentation of each budget to allow for questions. When I have presented the last budget in this group and questions have been addressed, the chair may wish to ask for a single motion for closing consideration on all of the budgets for which fiscal staff is responsible for developing recommendations. On page 39 of your closing package is the developmental disabilities budget 101-3154. Through a matching grant from the Federal Administration on Developmental Disabilities, this budget supports the Governor's Council on Developmental Disabilities in providing grants to the community, conducting analyses of disability services and provider systems, and identifying and filling gaps in service delivery to persons with disabilities. There are no major closing issues. On page 40 of your packet, there are 3 other closing items. And I'm happy to answer any questions on this budget.
Members, any questions? Okay, moving on.
Thank you, Madam Chair. On page 41 of your closing packet is the Grief Support Trust Accounts 101-3199. The Grief Support Trust Account supports nonprofit community organizations that provide grief support services to children who have experienced the loss of a relative or other person who has a significant emotional relationship with the child. There are no major closing issues and no other closing items. I'd be glad to answer any questions on this budget.
Members, any questions on 3199? Seeing none, moving on.
Thank you, Madam Chair. On page 43 of your packet is the Individuals with Disabilities Part C, Budget 101-3276. The Individuals with Disabilities Education Act Part C office serves as the designated lead agency for Nevada Early Intervention Services. The office monitors the compliance of providers with federal law and provides ongoing technical assistance to programs providing early intervention services. There are no major closing issues. On page 44 of your packet, table reflects 3 other closing items. I'm happy to answer any questions on this budget.
Members, do anyone have any questions or comments on that budget? Okay, see none, then I will move for the motion. Senator Ratty,
So moved.
and is your motion to Move as recommended that the following budgets be closed as recommended by the governor and request authority for staff to make the other technical adjustments as necessary for 3154, 3199, and 3276.
That is indeed my motion.
Thank you.
Second.
And second from Assemblywoman Carlton. Any discussion on the motion? Seeing none, we'll call for the vote.
Senator Canizaro,
Yes.
Senator Dondero Loop,
Yes.
Senator Hammond,
Yes.
Senator Kiekever,
Yes.
Senator Ratty,
Yes.
Assemblywoman Benitez Thompson, Assemblywoman
Yes.
Carlton,
Yes.
Assemblyman Frierson,
Yes.
Assemblyman Roberts,
Yes.
Assemblywoman Titus,
Yes.
Assemblywoman Tolles,
Yes.
Assemblyman Watts,
Yes.
Chairman Monroe Moreno.
And I am a yes, and that motion carries. Thank you, team. We'll move on to our next budget closing. It's 4862.
Yes, good morning, Madam Chair, members of the committee. For the record, my name is Colby Nichols. I'm a program analyst with the LCB's Fiscal Analysis Division. I'm here to cover 4 Division of Welfare and Supportive Services accounts, one of which was previously heard by the subcommittee and the other 3, which are staff closures. The first budget for the division will be the Energy Assistance Program. This is budget account 4862 and begins on page 47 of your closing packet. The first major issue for this account are caseload updates for the Energy Assistance Program. The Energy Assistance Program provides supplemental annual payments directly to energy providers to assist low-income households with the goal of reducing the energy burden of those households. The state share of costs for the Energy Assistance Program are funded through Universal Energy Charge revenues, which is a usage-based fee collected by utility vendors, as well as federal grants from the Low-Income Home Energy Assistance Grant. Consistent with previous practices following the budget hearing, the agency provides updated caseload projections in March 2021. The updated projections are based on actual caseloads and costs through February 2021. The updated projections are 1.1% lower for each fiscal year of the 2021-23 biennium when compared to those projections that were included in the executive budget. However, the agency is projecting the annual average assistance payment to increase by $2 from $701 to $703. There's a table at the top of page 49 of the closing packet comparing the difference in caseload and average annual payment between the GovRec projections and those included as part of the March 2021 update. As you can see, the number of households is projected to decrease slightly. However, the change in the average annual payment is leading to a net increase in expenditures and funding for this account. The table at the bottom of page 49, it shows a comparison between the funding for each of the decision units involved in the caseload update. Just to clarify for the committee, the M200 decision unit adjusts expenditures and funding to align the base budget with the service level projected for fiscal year 21. And then the M201 decision unit makes further adjustments to align expenditures and funding with the projected increases for fiscal years 22 and 23 respectively. During the budget hearing on February 18th, the subcommittee asked what factors the agency considered when determining whether to issue a supplemental payment and whether the agency anticipated issuing supplemental payments during the 2021-23 biennium. In response, the agency testified that it had structured the projected payments for the forthcoming biennium using conservative revenue projections. After the budget hearing, the agency indicated to staff that it would evaluate several factors, such as the amount of available revenues and the number of households on the program, on an annual basis to determine whether to issue a supplemental payment in the forthcoming biennium. Staff would note that the agency would request authority for supplemental payments through a work program revision, which is consistent with how the supplemental payments were issued during the current biennium. The subcommittee also inquired whether the funding amounts included in the budget would be sufficient to serve all of the program's recipients, or whether the agency anticipated implementing a waiting list or queue. In response, the agency testified that they anticipated the funding would be sufficient to serve all participating households. And following the budget hearing, the agency confirmed to staff that it did not anticipate implementing a waiting list for the Energy Assistance Program during the 2021-23 biennium. Again, referring to the table at the bottom of page 49, the net impact of the caseload update results in an increase of expenditures with associated revenues totaling $433,141 for fiscal year 2022 and $439,207 in fiscal year 2023. Does the subcommittee wish to recommend increased funding totaling $433,141 in fiscal year 22 and $439,207 in fiscal year 2023 to align funding in the M200 and the M201 decision units with the March 2021 updated caseload projections?
Members, any questions or discussions? Seeing none, I'll ask for the motion.
Chair, I would move to recommend increased funding totaling $433,141 in fiscal year 2022 and $439,207 in fiscal year 23 to align funding in the M200 and M201 decision units with the March 21 updated caseload projections.
We have a motion from Senator Ratty in a second.
Second, Chair.
Assemblywoman Carlton, any discussion on the motion? Seeing none, we'll call for the vote.
Senator Cannizzaro,
Yes.
Senator Dondero Loop,
Yes.
Senator Hammond,
Yes.
Senator Kiekeper,
Yes.
Senator Ratty,
Yes.
Assemblywoman Benitez Thompson,
Yes.
Assemblywoman Carlton,
Yes.
Assemblyman Frierson,
Yes.
Assemblyman Roberts,
Yes.
Assemblywoman Titus,
Yes.
Assemblywoman Tolles,
Yes.
Assemblyman Watts,
Yes.
Chair Monroe Moreno.
And I am a yes, that motion carries. Moving on.
Thank you, Madam Chair. Again, Colby Nichols with LCB Fiscal Analysis Division. The second major issue for the Energy Assistance Program is the reclassification of 4 positions. Discussion of this issue begins on page 50 of your closing packet. The agency is requesting to reclassify 2 positions, 2 administrative assistant positions to family service specialist positions, as well as 2 program officer positions to family services supervisor positions to better align the job's classifications with their job duties. One of the administrative assistant positions that is recommended for reclassification is currently intermittent. And there are some technical issues that were identified in the executive budget associated with reclassifying this intermittent position into a full-time permanent position. During the budget hearing, the subcommittee asked for clarification regarding the difference in duties and responsibilities between an administrative assistant and a family services specialist position. In response, the agency testified that the agency's administrative assistants did not serve as subject matter experts or as lead workers. The 2 administrative assistant positions recommended for reclassification would allow the agency to increase the staff resources available for training and program education. And these 2 new family services specialist positions would serve as lead workers for the agency's remaining administrative assistants. In addition, the subcommittee inquired on how reclassifying the program officer positions to family service supervisor positions would improve the day-to-day operations of the program. The agency indicated the level of managerial and oversight duties for the existing program officer positions were not in line with the compensation level for those positions, which has contributed to a high turnover rate. The agency clarified the intent of the request is to properly align position classifications with the duties involved and to improve staff retention rates for the Energy Assistance Program. The agency indicated that family services supervisors and other departmental budgets were typically promoted from within those programs, and thus had a high level of experience and expertise in those programs. The agency indicated that these proposed reclassifications would improve the operations of the Energy Assistance Program by making it easier to retain qualified and experienced staff. Regarding the technical issues discussed previously, following the budget hearing, fiscal staff has worked with the agency and the Governor's Finance Office to correct these issues. Accordingly, should the subcommittee wish to approve this recommendation, fiscal staff recommends 2 technical adjustments, which are listed on the bulleted points towards the bottom of page 51 of your closing packet. The first of which would restore approximately $54,000 in each year of the biennium to account for costs associated with the intermittent position that were erroneously excluded from the base budget. And the second is to various adjustments to the E805 decision unit to correctly align various personnel and other associated costs to reclassify that intermittent administrative assistant position to a permanent family services specialist position. These adjustments result in a net increase in expenditures totaling $8,135 in fiscal year 22 and $8,630 in fiscal year 2023. Combined, the net impact of these 2 adjustments totals $62,652 in fiscal year 22 and $63,147 in fiscal year 23. And those adjustments would be funded 68% through universal energy charge revenues and the remaining 32% funded through federal grants. The agency and the Governor's Finance Office concur with these recommended technical adjustments. Does the subcommittee wish to approve funding for the reclassification of 2 administrative assistant positions to family service specialists and 2 program officer positions to family services supervisors, with the noted technical adjustments to restore seasonal expenditures of $54,417 in the base budget each year, and the adjustments to the E805 decision unit to correctly align various personnel and other associated costs, with the recommendation to reclassify an intermittent administrative assistant position to a permanent family services specialist position for an additional cost of $8,135 in fiscal year 22 and $8,630 in fiscal year 2020.
Members, any questions or discussions before I call for the motion? Seeing none. Senator Reddy?
Chair, I wish to approve funding for the reclassification of 2 administrative assistant positions to family service specialists and 2 program officer positions to family services supervisors with the noted technical adjustments to restore seasonal expenditures of $54,417 in the base budget in each year, and the adjustments to the E805 decision unit to correctly align various personnel and other associated costs, with the recommendation to reclassify an intermittent administrative assistant position to a permanent family services specialist position for an additional cost of $8,135 in fiscal year 22 and $8,630 in fiscal year 2023.
That was a mouthful. Can I get a second?
Second, and good job on the motion.
Any discussion on the motion? We'll see none. We'll call for the vote.
Senator Canizaro,
Yes.
Senator Dondero Loop,
Yes.
Senator Hammond,
Yes.
Senator Kiekever,
Yes.
Senator Ratty, Assemblywoman Benitez Thompson,
Yes.
Assemblywoman Carlton,
Yes.
Assemblyman Frierson,
Yes.
Assemblyman Roberts,
Yes.
Assemblywoman Titus,
Yes.
Assemblywoman Tolles,
Yes.
Assemblyman Watts,
Yes.
Chair Monroe Moreno.
And I am a yes, and that motion carries. Moving on.
Thank you, Madam Chair. Again, Colby Nichols, Fiscal Analysis Division. In addition to the major issues, there is one other closing item for this budget, which is listed on page 52 of the closing packet. Fiscal staff recommends this other closing item be closed as recommended by the Governor, with authority for staff to make technical adjustments as necessary.
Thank you. Members, any questions or discussion on the other closing items in this budget? Seeing none, I'll entertain a motion from Senator Ratty
And second, Madam Chair?
and second from Assemblywoman Carlton. Any discussion on the motion? Okay, we'll move for the vote. Call for
Senator,
the vote.
Senator Canizaro,
Yes.
Senator Dondero Loop,
Yes.
Senator Hammond,
Yes.
Senator Kiekover,
Yes.
Senator Ratty,
Yes.
Assemblywoman Benitez Thompson,
Yes.
Assemblywoman Carlton,
That's you, excuse me. Yes.
Assemblyman Frierson,
Yes.
Assemblyman Roberts,
Yes.
Assemblywoman Titus,
Yes.
Assemblywoman Tolles,
Bless you and yes.
Assemblyman Watts,
Yes.
Chair Monroe Moreno.
And I'm a yes, and that motion carries. Moving on to 3232.
Thank you, Madam Chair. I will now begin presenting the budgets which the subcommittee has not previously reviewed for the Division of Welfare and Supportive Services and for which fiscal staff is responsible for developing closing recommendations. I will pause following my presentation on each budget to allow for questions. When I've presented the last budget in this group and the questions have been addressed, you as chair may wish to ask for a single motion for closing consideration on all of the budgets for which fiscal staff is responsible for developing closing recommendations. The first budget recommended for staff closure is Assistance to the Aged and Blind, budget account 3232. This begins on page 53 of your closing packet. The Assistance to the Aged and Blind program provides supplemental income to low-income aged and blind individuals who are receiving supplemental security income and provides adult group care facilities with supplements to help recipients avoid or delay institutionalization. There are no major closing issues in this budget. There is one other closing item consistent with the other division budgets. The agency has provided updated caseload projections as of March 2021, which again are based on actual caseloads and costs through February of 2021. Again, the M200 decision unit adjusts funding to align with fiscal year 21 caseload, and the M201 further adjusts the funding to align with the projected changes for fiscal year 22 and 23 respectively. In addition, fiscal staff is recommending a technical adjustment to the base budget, which is reflected on the first page of this closing, to adjust the costs associated with projected increases in the administration charge in the 2021-23 biennium, which are also included as a part of the March 2021 caseload update. There's a table towards the bottom of page 54 showing the aged, blind, and adult group care facility caseloads, including actual counts for fiscal year 2020, as well as a comparison for fiscal years 21, 22, and 23 between the projections that were included in the executive budget as recommended by the governor and the updated projections that were provided to staff in March 2021. In total, the updated March 2021 caseload projections result in total anticipated payments to the aged, blind, and adult group care facilities of approximately $11 million in fiscal year 22 and $11.2 million in fiscal year 23, which represents a decrease of $79,616 in fiscal year 22 and $153,566 in fiscal year 23, when compared to the amounts recommended in the executive budget. There's a table at the top of page 55 of your closing packet that compares the total funding for the assistance in the aged and blind budget with the amounts that are included in the executive budget compared against the projected amounts from the March 2021 caseload. Fiscal staff would note that the aged and blind payments of $36.40 and $109.30 respectively do not change from year to year. And the change in the average payment that has been noted by the division is a result of the projection methodology. The executive budget does not recommend a state-funded increase in the amount of supplement paid to eligible aged and blind individuals or a rate increase for group care operators. That concludes my presentation on this budget. I'll pause briefly for questions if there's any.
Members, do you have any questions on this budget before we move to the next budget closing? Seeing none, Mr. Nichols, you can continue.
Thank you, Madam Chair. Again, Colby Nichols with LCB Fiscal Analysis Division. The second staff closed budget is budget account 3238. This is the Child Support Enforcement Program. The Child Support Enforcement Program provides 5 basic services: the location of absent parents, the establishment of parentage, the establishment of child support orders, the collection of child support payments, and enforcement of private medical insurance. There are no major closing issues with this budget. There are 2 other closing items that are summarized in the table on page 58. That concludes my presentation on this budget. I'll pause here for questions if there are any.
Members, do you have any questions on the budget closing document? Seeing none, we'll move on.
The third staff closing budget is the Child Support Federal Reimbursement Budget. This is budget account 3239 and begins on page 59 of your closing packet. The federal reimbursement budget is a companion to the Child Support Enforcement Program one, and this budget is used to pass through federal payments to the participating district attorney's offices for the federal share of costs and incentive payments that are associated with those counties' local child support enforcement programs. There are no major closing issues or other closing items associated with this budget.
Members, any questions on this budget closing? Okay, seeing none.
All right, Madam Chair. Fiscal staff would recommend that the following budgets be closed as recommended by the governor with the identified technical adjustments and authority for staff to make other technical adjustments as necessary. So budget accounts 3232, assistance to the aged and blind, budget account 3238, child support enforcement program, and budget account 3239, the child support federal reimbursement budget.
Senator Betty?
I would like to make a motion exactly as Mr. Nichols just stated it.
Thank you for the motion. The second?
Second, Madam Chair.
Thank you, Assemblywoman Carlton has second. Any discussion on the motion? All right, seeing none, we'll call for the vote.
Senator Canizaro,
Yes.
Senator Dondero Loop,
Yes.
Senator Hammond,
Yes.
Senator Kiekover,
Yes.
Senator Ratty,
Yes.
Assemblywoman Benitez Thompson, Assemblywoman Carlton,
Yes.
Yes.
Assemblyman Frierson,
Yes.
Assemblyman Roberts,
Yes.
Assemblywoman Titus,
Yes.
Assemblywoman Tolles,
Yes.
Assemblyman Watts,
Yes.
Chair Monroe Moreno.
And I am a yes. And that motion carries. That is our last budget closing item for today's agenda. We are at the end of our agenda, and that would be public comment. And I would ask our broadcast staff if we have anyone on the line wishing to make any comments today.
Chair, this is Michael from Broadcast. The public comment line is open and working. However, we have no callers at this time.
Thank you. Well, members, I know that we all have a very busy day, being that it is the end of our first cram week in this building. So I wish you all much luck on your other policy bills as they move through the process, and have a wonderful weekend. And I will see you all next week. This meeting is adjourned.